Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
When it comes to making sure you understand your medications, who would you say is on your pharmacy team? Your doctor? Your pharmacist? They certainly are, but you may be surprised to learn the most important member of your pharmacy team is you. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today's show is about what you need to know about your medications. Stay with us, we'll be right back. Welcome back. Part of being a member of your pharmacy team means knowing about the medications you're taking. Joining us this morning is Lisa Sather to talk to us about how to do that. Lisa, thanks for being with us this morning.
You bet, Beth. Thank you.
Can we start out by just explaining what is medication reconciliation?
Sure, that's a great question. So medication reconciliation is when you make a complete list of all of your prescription and over-the-counter medications, and that includes the name of them, the dosage, how they're taken, the frequency, how many times per day, and you want to compare that with the medication list that your hospital, your provider, your pharmacy has. So it's really important to have a complete list of those things, and typically that's done when you transfer care from one healthcare setting to another, like say you're leaving a hospital, going home, leaving a hospital, going to a nursing home, home to a nursing home, et cetera, et cetera. So that's what we're talking about when we're talking about transition of care.
Okay, and so who does a medication reconciliation? Does your doctor do that for you? Can you do that for yourself?
Sure, really anyone can do that. Certainly you can do that for yourself. Typically you're going to see a pharmacist doing that, a physician doing that, a nurse can even do that. You could even ask a caregiver to help you do something like that. It's just really important that you get a complete list. And also it does somewhat help if you have someone that's skilled in medications and knowledge about those, because names can be confusing, and in order to understand that you're not having a duplication of a medicine and things like that, that's really where it does come in helpful to have someone that's trained in medications. The whole basis of this is you really want to make sure your list is complete so that you don't miss a medicine when you're transitioning, you don't have a duplication of a medicine, things like that. That's the important pieces we're looking for.
So you mentioned that medication reconciliation happens at a care transition.
Yes.
Does it happen automatically? Is there a time when you should be requesting this to happen?
Sure, it really does depend upon the healthcare system. So typically upon discharge from a hospital, that's something that in most cases is going to happen at some level. The situation is that sometimes there can be gaps, and it is different from different healthcare system to healthcare systems. So definitely if it's not something that has happened for you, it is something that you should definitely ask for. The importance of that is it will also help you understand your medications, help you be in tune with that. You are one of your biggest advocates, of course, and so if it is not something that you have had offered to you, it is definitely important to ask and get that done.
Okay, great. And why would you say you should perform a medication reconciliation? Why do it?
That's a great question. So medication errors is really the biggie here. Nearly half of all medication errors happen at some transition of care. And so that's important. We know that if a person is missing at least one or more of their medications upon a transfer of care, they're more than 50% likely to have some type of an adverse drug event. And they're also more likely to get hospitalized even within that first month after they leave the hospital. So that's why it's really imperative that we understand our medicines, and it'll help you not to make mistakes.
Okay, perfect. So a medication reconciliation, you said, is basically putting together a list of your medicines that you're taking. It seems pretty straightforward, just creating a list, but it can actually be really complicated, right? Can you talk about that a little bit?
Sure, that's right. I kind of mentioned earlier, the process can vary from healthcare system to doctor to pharmacist. There's not one national type list that's available in order to perform a medication reconciliation. So since the documentation differs, there can be sometimes inconsistencies in information. That's why it's just really important to work with those you're comfortable with, your providers, in order to put together that complete list.
And you mentioned the inconsistencies, but the one constant there obviously is the patient. And the problem or the difficulty there is a patient isn't necessarily an expert on his or her medications. And so for those folks out there who maybe feel a little bit overwhelmed, maybe they take a lot of medications, any advice on how to kind of put this together, make sure that everything is accurate? How do you go about doing it if you don't have that knowledge, like you said?
Absolutely. So I think the biggie is ask for help. You know, whether that means seeking out your family member to sit down with you, help you sort through that. I think even more importantly is to talk with your doctor and your pharmacist. Your pharmacist, if you're using one pharmacy, which we highly recommend, they're going to have that complete list and share with them your over-the-counter medications. So I think that's really imperative. The other thing you can do is you can take all of your medicines in a bag to your doctor's office when you have a visit so that they're able to reconcile with the medicines that are on their list that they have on record there as well. And I think also another key point is that if you're in a hospital situation or a nursing home and you're transitioning, to ask questions. Make sure you understand, and it's important also, I remind people, take notes. If you don't have something that's printed out for you, even if you do, it oftentimes is very helpful to jot down notes to help you keep things straight. So make sure to do that.
Okay, good advice. So if you're working with your doctor or your pharmacist to do a medication reconciliation, is that also a time when you can check for maybe medications that might interact with one another?
You know, that's possible. It depends upon the skill, obviously, of the person doing the reconciliation. At some level, obviously, on your new prescriptions and refill prescriptions and those kinds of things, if you're seeing one pharmacy, that should be kind of done at that point in time. But if you have any questions at all, you definitely should ask your pharmacist, especially if you have a new prescription that's being added.
Okay, we have about a minute left here. There are some websites online. They're called interaction trackers. You can go in, and sometimes they have lists of medications. Sometimes you type them in, but you can put your medications in and find out if there are interactions. Would you recommend these kind of sites?
You know, certainly there are some trustworthy ones out there. Drugs.com has one. I was just online this morning. CVS has one. Some of the national chains have those. They even link, you can pull up the drugs that you take through those companies. So yes, I mean, that is a good, valuable tool. The important thing to remember about this is if you do go online and you do that, it's kind of sometimes difficult to evaluate whether or not the level of interactions are extremely severe and those kinds of things. So I always recommend that you talk to your pharmacist about those if you do come up with something that's flagged, to ascertain whether or not it's really clinically significant. Also, to follow up on that, another important thing is you want to make sure you don't just stop things cold turkey. You need to talk with someone first.
Perfect. Thanks, Lisa. We do need to take a quick break. But coming up next, there are several medications that patients must take with caution because they are notorious for causing drug-to-drug interactions, not only with other prescriptions, but with over-the-counter medications too. We'll talk about that right after this. Stay with us.